You can see that cardio means heart, vascular means blood vessel. So diseases relating your heart or blood vessel is known as a cardiovascular disease, and sometimes known as CVD. Any disease affecting heart and circulation, including heart disease, angina, heart attack, congenital heart disease, and stroke. All this can lead to cardiovascular disease. Then one common type of cardiovascular disease is the blood pressure. So blood pressure, you know that this is the normal blood pressure 80 to 120. If it is higher than 120 and higher than 80, we call that situation by the name hypertension. If it is lower, we call it by the name hypotension. Now, in case of hypertension, the problem with hypertension is that can result in kidney failure, heart disease, and also stroke. So these are the two major problems associated with the higher blood pressure, and blood pressure is sometimes known as silent killer, because blood pressure can damage our kidney tubules, and kidney will be affected, and sometimes the kidney cannot function. There is total failure of the kidney, which is known as acute kidney failure or chronic kidney failure. Then so this is the primary risk factor for our heart disease, heart failure, aneurysm. So hypertension can be a major problem. So one thing we can do for hypertension is that exercise, daily exercise is good. Then we should also manage our stress level. So all these will be reducing the hypertension. Then arteriosclerosis. Second disease is you have studied about this arteriosclerosis. This is what is happening. This is the normal blood vessel. When there is a lot of fat or cholesterol, that will be deposited here, and that cholesterol deposition is known by the name plaque. When too much plaque is there, the cavity of your artery or blood vessel will be narrowed or reduced or sometimes completely blocked. When there is complete block or more very narrowing, less blood will be reaching on the other part of the blood vessel, and that will means less blood to certain vital organ. If it is going to the brain, then brain may not be getting enough blood, and that will result in stroke. If it is to the heart may not be getting blood, and that also result in heart failure. So these are the important of situations known as arteriosclerosis. Then, as I told you, stroke is a major situation. So in case of stroke means a sudden interruption in blood supply. A sudden interruption means block. Sudden interruption in blood supply is known by the name a stroke. There are two different types of strokes are there. One is ischemic stroke, is one type. So in the case of stroke, what happens is that one part of the brain, certain part of the brain may not be getting enough blood, and that situation is known by the name stroke. I will show you a picture of stroke. So in a stroke, usually what happens is that certain areas of the brain, you can all see that. See, this is what is normally happening in a stroke. See, in the case of this stroke, see the part that is going to this area that is affecting. So the entire cells here may be damaged. So that is what is happening in the case of a stroke. So stroke is a sudden interruption, stopping of blood supply to one part of the brain, and entire cells there will be damaged. So one is an abrupt blockage, and it is known as an ischemic stroke. Now there is another situation in which when too much blood, when there is some clot, and as a result of clotting, certain blood vessels are blocked. And what happens is that blocked blood vessel may rupture or break, releasing most of the blood into the brain. Then it is known as a hemorrhagic stroke. So these are the two common type of stroke that we can see, and see ischemic stroke as well as hemorrhagic stroke. So in the problem with the stroke is that stroke can damage the brain. When one part of the brain is damaged, what happens? For example, your left side of brain is damaged. then what happens? Your right side of your body will be completely paralyzed. Your nerve mechanism may not be working. You cannot walk. Sometimes you cannot move hands. Sometimes you cannot speak. Sometimes your intelligence may be affected. But one advantage of stroke is that if it is taking place in younger individual, they may be able to recover after 1 month. Some people may recover after 6 months, some after 3 months, some may take 1 year. So higher the age, older the person, the chance of recovery in the case of a stroke is also less. So these are the three common type of diseases: blood pressure, arteriosclerosis, as well as stroke.